President Muhammadu Buhari charges NDLEA to step up modalities of curbing drug abuse and trafficking. Enugu state government moves to nip use of psychotropic substances in the bud. Plus, in Abakaliki, NYSC takes free Medicare to the hinterland. Good afternoon. This is Panorama, reaching you live from the Enugu Network Center. I am Mina Adobu-Kobasi. President Muhammadu Buhari has challenged the National Drug Law Enforcement Agency, NDLEA, to smoke out criminal elements growing cannabis plantations within deep rainforests in the country. This was while launching the War Against Drug Abuse, WADA, in the State House, where he was represented by the Secretary to the Government of the Federation, Bas Mustafa. Mitairi Ben reports.
Policymakers are here to mark the United Nations International Day Against Drug Abuse and Illicit Drug Trafficking. They agree that the rise in criminality nationwide is traceable to drug abuse and trafficking. For President Muhammadu Buhari, who was represented, the enormity of the danger of drug abuse calls for urgent collaboration by all citizens to nip the problem in the bud. He says the NDLEA must, however, lead the fight by destroying production hubs and breaking supply chains.
To drive these criminal elements from such hideouts, because they use it for the growth of these plants and also to conclude and plan their adventures on our people. So it is more deadly than even the security challenges that we are having in this country.
The NDLEA chairman reveals that Nigerians are the highest users of cannabis globally, with more than 10 million persons actively abusing the substance.
Kidnappers, robbers, insurgents, or perpetrators of grave crimes need mind-altering substances, be they cannabis, cocaine, or tramadol, to help them muster the courage to commit atrocities. It is in this way that illicit substances are enablers of insecurity.
The consensus is that the war against drug abuse should not just be a slogan, but a civil action involving all Nigerians. In Abuja, Mitaire Ikmen, NTA News.
Is set to assist in saving lives and prevent indulgence in illicit drug trafficking. Abdul Malik Hassan reports that NDLEA is introducing another approach to fighting drug menace as it premieres a movie titled The Silent Baron, a food for thought for would-be traffickers.
Tells the story of a drug trafficker who lived a deceptive life but finally got caught up by the long hands of the law, but not without ruining the lives of many. The plot is to share facts on the dangers of engaging in illicit substance trafficking to protect lives.
Who's that?
Please, let's have your bag. Yes.
I'm with somebody here.
Okay, answer the bag, please.
Ifeanyi Okaru, the writer and producer of the movie, says criminal activities influenced by the drugs inspired the movie.
The perpetrators of most heinous crimes, like kidnapping, armed robbery, banditry, and such like, they draw their inspirations from the influence of illicit drugs.
People are skeptical, sometimes you don't believe what you're doing, sometimes people criticize, but when you do it together with documentary, you do it together with films like this, it has a lingering effect.
You see an idea of what's going on and tries to at least tell the youths to actually shun away from crime, shun away from drug dealing.
Stakeholders see the premiere of the movie as timely and believe it will make positive impact in the heart of many young people.
And it will be part of the advocacy for our youths to be careful, more than anything else, than don't take people at their face values. Don't take people at their face values. And it also demonstrates as a deterrence to those who are engaged in trafficking that they have the NDLEA to contend with.
There is optimism here that if such facts are shared through the right channel, crime will be reduced in the society. In Abuja, Abdul Malik Hassan, NTA News.
There is an upsurge in the use of psychotropic substances in the state. Much arrests are made, several cases taken to court, while minor cases are on rehabilitation. Comfort Iron takes a look at the effects of drug abuse on the populace.
In medicine, any drug or other substances that affect the brain and cause changes in mood, behavior, emotions, thoughts, or perception is a psychotropic substance, otherwise known as psychoactive substances, an umbrella term for a lot of different drugs, including prescription drugs and commonly misused drugs. And these substances are found in a number of medications as well as in alcohol, illegal and recreational drugs. Influence of the manufacturers and inability to prevent the widespread availability of dangerous drugs also worsens this problem, a situation that creates socio-economic burden to the nation and also contributes to the rise of violent crimes in the country.
In Enugu, we do arrest such from time to time. We make sure that we take them to court if they are the one to be taken to court. Because we discover that so many people are into taking drugs because of lack of knowledge.
Young people, adolescents, school dropouts in their ever-increasing rates are exposed to the risk of using psychotropic substances due to multiple factors, including bad influence, stress, and depression.
The rate of dropouts among students are high. If you go into a drug board admission now, you find out that majority of the people that are there are males. And most of them that started smoking from primary school did not complete secondary school.
Seizures, stroke, mental illness, as well as lung disease are among the health problems of taking psychotropic substances. And experts say enforcement policies need to be improved to achieve a drug-free society. Increased awareness on drug abuse has also become imperative in the renewed drug war and fight against psychotropic substances. In Enugu, Comfort Ayim, NTA News.
And that report forms our background for discussion today on Panorama, and with me in the studio to speak on the alarming rate of drug abuse in the country is the Commander NDLEA, Enugu State Command, Anieta Basi Iding. Sir, you're welcome to Panorama, sir.
Thank you for having me.
All right, sir. Let's take a look at some of the research and data. It says 15% of adults in Nigeria use drugs. I think that is rather alarming. What do you think?
It is not only alarming, it is disturbing. The drug problem in Nigeria is almost becoming endemic. It is not only the adults that indulge in drug abuse. All segments, all strata of the population indulge in drug abuse. The students, the adults and the young adults, they all indulge in drug abuse.
Okay, so it's a terrible situation.
It's a very terrible situation.
Okay, so let's look at the 2015-2019 National Drug Law Master Plan, which of course is supposed to be a roadmap to winning the crusade against drug. Do you think it's yielding dividends?
Yeah, the 2015-2019 master plan is almost coming to an end. And the 2021-2025 is soon to be launched. The master plan is multi-sectoral. It's anchored on 4 pillars: the law enforcement, the drug demand reduction, and the access to narcotic and procurement of chemicals for medical purposes, and the coordination of activities of other agencies that is working in tandem to make the master plan works. The aspect of law enforcement that concerns my organization,
yes,
I think we've done well. In the aspect of drug demand reduction, I think we've also succeeded, because we've been able to cut a lot of supplies. The access to narcotic drugs for medical purposes, that is driven by another agency. I want to believe they are also
doing well. Okay, let's look at the supply and demand reduction approach, which is been introduced by your agency. And also, how effective is that really?
Definitely, it's very effective. You cannot achieve much if you didn't reduce demand. If you continue to cut supply and the demand is high, definitely there must be a way that gap is filled. But if you reduce demand and reduce supply at the same time, then definitely the quantity available, the prevalence in the society will drop. Because a lot of people, or people that are experimented before on drugs, have been taken off. And there might not be no need, because the new ones already have information on how to manage themselves. So they might not have the need to go into drugs. So that alone will reduce the need for drugs. And when there is no need for drugs, then the supplier may not have the need to bring it.
With all these approaches in place, there still seems to be some kind of rise in the use of drugs. Do you think the stakeholders are doing enough to curtail, or are there some other challenges your organization is having?
Well, the NDLA is like every other government agency. We get our resources from the same source. We work within the limit of our resources. The government is doing their utmost, because the government is not attending to agency alone.
So
we also need to bring on board other stakeholders, public-spirited individuals, NGOs. They can come in different ways. As of now, there are shortages of rehab centers in Nigeria. We need individuals to come into
bring in more rehab centers.
Either as a business or as a voluntary social services.
This year's theme, Share Facts on Drug, Save Lives, do you think is apt?
Yes, it's very apt. It could have come at a better time, because there is need to give people, or to let out the public know what is the true position of drugs in the country. People also need verifiable and empirical evidence, things that have been tried and tested. If you give them these facts, they will be able to differentiate between facts and fancy.
Okay, your final word, sir, as the world marks International Day for Drug Abuse.
I want to encourage all of us. I want to encourage the general public. I want to encourage states and non-state actors. I want everybody to be on the same page with NDLA. I want everybody to understand that the fight against drug abuse and illicit trafficking should not be left in the hands of the agency alone. What affects one should affect all.
Okay, thank you so much, sir. That's been the commander, NDLEA Enugu State Command, Anita Bassi. Thank you so much for coming on board today. Thank you. All right. to take a short break here. Panorama will continue, but before then, our attention has been drawn to a set of figures circulating in the internet without signature or attribution and purported to the Anambra APC primaries results. The figures do not owe to Anambra State APC primaries, which did not hold, and for which we look forward to the caretaker national executive of our great party to choose a new date within INEC timetable. The leader of our great party in Anambra State and Minister of Labour and Employment, Senator Dr. Chris Nwabezengige, has proposed Tuesday, June 29, 2021, for the primaries to hold, and we recommend that it should be considered. In the time being, the figures should be discarded and discountenanced as they are figments of fertile imagination with potential of being fatal. We'll take a short break here. Panorama returns in a moment. Stay with us. Welcome back. Beyond the mandate of uniting the nations through its activities, the National Youth Service Corps has been repositioned to proffer solutions to some of the nation's challenges. In view of this, Ijoma Peter Wante reports that the Corps recently took her free medical services to the grassroots in Ebonyi State.
Having observed that varied ailments such as malaria, typhoid and cholera are among the health challenges facing rural dwellers, the 2021 free health intervention of the National Youth Service Corps carried out their free medical care to Onyikwa and Abenyim in Ebonyi and Izi local government areas. The exercise, which has as its theme Health is Wealth for Advancement, is said to be a right step in a right direction by the beneficiaries, who are mostly the elderly.
May God bless them. I'm happy about it, how the copper give me the medicine. Over 2 or 3 years, I'm suffering from sickness. I'm praying to God, make it medicine will give me, make it cure the thing.
The state NYSC coordinator, Mrs. Mercy Bamai, and the representative of the Director National Youth Service Corps Southeast, Mr. Caleb Ishaya, said the program aimed at taking quality healthcare delivery to the doorsteps of rural dwellers is part of their roles in contributing to the development of the country.
In addition to the treatment of patients, the medical outreaches also feature sensitization of community members on disease prevention and care. Furthermore, the scheme has donated over 300 wheelchairs with the support of partners through this program.
We, more grease to your elbow, do your jobs as you have been trained.
The exercise also witnessed talk show on COVID-19 and malaria in Abakaliki. Ijoma Peter Wante, NTA News.
The recent and incessant attacks on public institutions in Anambra State have raised concerns about the safety of school children. Jane Francis Obi reports that the state government has responded by launching the Safe School Initiative program designed to provide adequate security for school children.
The program involves perimeter fencing of schools, introduction on security education in the school, and security clubs. The Anambra State Commissioner for Basic Education, Kate Omenowa, said the state government is working to ensure schools are protected.
We are setting up IP cameras in all our schools. That was especially within the time that we're having exams. Beyond that, we are teaching security education in our school, where we let the students know how they can report anything that they find strange. How do they know when there is an infringement on their rights?
The Assistant Inspector General of Police, Zone 13, Mr. Mukadas Garuba, also assures of efforts to restore calm in the state.
The young people actually, we have parents, have guardians. I want to advise the parents and guardians to guard their children, to make sure that to monitor their association with even friends and their peers, And then to warn the young girls that are into cultism and other menaces to desist from it, otherwise they will meet the wrath of the law.
Meanwhile, some of the schools visited are of the opinion that the state government needs to pay more attention to the issue. They agree that security for schools should be a collective responsibility of everyone in the state. In Oka, Jane Francis Obi, NTA News.
Nigeria has recorded 35 new cases of COVID-19. Lagos is leading with 30 new number of cases, followed by Kwara 3, while Gombe and Kano has 1 case each, bringing the total number of confirmed cases to 169,465, with 165,946 discharged and 2,119 deaths. Let's now join Olale